Welcome back to Happy Health Hour. And with me, Dr. Nawtej Dosanjh, is Dr. M and Dr. P. How are you both?
Great, Nawtej.
This is our final episode before Christmas. Do you guys take a break at Christmas, or do you carry on working?
Christmas is every day, sir.
Okay.
Healing continues. It doesn't stop.
Continue.
Christmas, great light and joy and bliss, and now you can go back to your ugliness and squalor and darkness and ignorance and lack of health.
Okay, Dr. P, that's enough.
He has no dearth of smart answers.
He has, exactly.
So for Dr. Scanziano, who deals with regenerative medicine, Christmas is every day. For me, who deals in degenerative medicine, Christmas is one day a year.
Okay, you know something? I think I'm sorry I asked you the question. Let's just get on with the show. This week's episode with Dr. M and Dr. P is about long-term use of substances and why patients can't understand why they shouldn't be on certain substances for the long term. I suppose the central question. And we're doing this because we've talked about the body, we've talked about healthy ways of being and unhealthy ways of being. And so this is a natural topic for us to discuss. And I suppose the central question here is, why do patients struggle to understand the risks of long-term substance use? Dr. M, maybe you can start with that one while Dr. P thinks of some smart answer he's going to give with the two of us. Maybe you can start with the answer. Why do we not understand this? Is because I have an intuitive sense that long-term use of substance is not good. I don't think I have a detailed sense, but you're going to enlighten and educate me today and our viewers. But why do people, a lot of patients just don't understand the risks of long-term substance use?
Well, the proof is in the pudding. Nawtej, when you're talking to a patient, a human being, you need to teach them. That's my thing. You need to teach them what you're about to give them. It can cause the following. So when you give one substance, they should know what the substance does and what it does in a positive and a negative sense, because all substances that are given, all pharmaceuticals, anything that's prescribed and even over-the-counter stuff, we should know that it has potentially, it's no guarantee, a potential good effect, a potential negative effect, or multiple negative effects. For that matter, it can have multiple positive effects. So if we don't have, as providers, that information available to the person, we don't provide it, we don't render a good, little, solid, concise explanation, that person assumes that it's all good. And then, things happen unbeknownst to the person. And the person now, they have all these side effects and things like that can happen. And they're Googling and they're looking, and then they're calling the doctor, I feel terrible. So then another prescription perhaps is prescribed, because one prescription can cause maybe respiratory or painful side effects. And so the doctor may not realize it, and person just says, I feel terrible. And okay, well, let me order you another drug, all right? Mm-hmm. Something to alleviate your symptom. Not asking, well, what have you done? Where have you been? What are you taking? I'm not saying that all doctors don't do that, but there, by and large, are a lot of guys and gals who will, as providers, who will just assume, something happened to you, and here's another substance to take. So you have all these substances. Now we're going to get into more depth on the type of substances that are really heavy duty. For instance, like an opioid and an anxiety medicine or an antidepressant or a pain another pain medicine that may be prescribed, and the combinations of those, that's really getting into murky waters, because the side effects can be, incredibly long, a list, that is, and you can have some really serious consequences. So, and people who don't know, that's basically the bottom line. They don't know these mixes and these combos, what they can actually cause, combined. One drug can cause a lot of stuff. You start combining them, and if your doctor doesn't know that you're taking multiples, or they don't review it, we're setting up for a disaster.
Okay, let's dig a bit deeper. So I'd love to understand, but as I said, I have an intuitive sense that long-term use of substances is not a good idea, but I don't know the details, and nor do our viewers, many of our viewers. So I want to talk about the emotional, side effects and the side effects on the brain. So, Dr. P, which one would you like? The emotional or the brain? And then we can put Dr. M under pressure. She takes the other one. So what do you think? Which one do you want to talk about? Emotional or the brain?
I can take whichever you like, because I don't want to separate the two. I think we have to realize they're very deeply interlinked.
So why don't you answer the question in the way you would like to answer it, relating the two? You're the expert, not me. So you answer that question in the way that you think it should be answered.
So look at the underlying problem. The underlying problem is a false paradigm. The paradigm is that the body is like my car, and if the ignition is not working, you go and fix that. There is not enough oil, you pump the oil. Tires are not, properly inflated, so you put the pressure and put the air on. Though even at the level of the car, you have to take a systemic view. The body is far more complex. The body is not just a physical structure, interrelated springs and tumblers and moving like a clock. It is not that. This is a Cartesian viewpoint. And this is a very reductionistic approach that the body is complete by itself. It is not. In fact, it is a beautifully unique system which is multidimensional. And to approach it with a unidimensional idea or attitude is a flawed approach which can give you dividends for a limited period of time, for acute conditions, for a short-term, treatment or therapy. But long-term, not only is it not effective, mostly, but it may be counterproductive. So, for example, very simple. If I have a cut, immediate action, stop the bleed. Common sense, right? But if I have a deep psychological, emotional issue, I said if, then the problem is not just popping pills. It could have been something you said to me last discussion, which is still hurting me, or my whole paradigm culturally where I come from. Now I'm in a different culture. I don't have friends who talk to me in my language. I don't have my food. I don't have the connect. I don't know. I'm just making it up, right?
Yeah.
My neighbor doesn't talk to me. My friend from school doesn't respond to my WhatsApp. I don't know. So many complex issues. My father looked at me sternly when I was 2 years old. So we are complex creatures who have the unique ability to create our own problems. We have PhDs, which will probably delight you. We have PhDs in how to create our own narrative and create diseases where none exist. So now in that paradigm, we have become lazy. We have become complacent because externally we feel like we have reached a point and we have reached development. No. Physically, you may have some sophistication, but inwardly, we are still immature. We are barbarians. The treatments we are using, so look at the, bloodletting, right? In the old days, they used to put leeches on you, and they would make you, poor George Washington, who was the first president of the US, he was killed by the doctors because they didn't know enough. Well, we still do the same things, just the approach is different. The modality is different. So, first thing, lack of understanding, lack of a holistic view of the entire existence. Our existence is not a divided existence. It is rather quite multidimensional and at multi-layered. Beginning to see that as an education of oneself. Two is lack of ownership. I want to be lazy. So just like I like fast food, I drive by, get my, McDonald's and burgers and your French fries. So drive-by colonoscopies, why not? You just drive by the doctor's office, he'll pop in a pill, and I'm fixed, and I'm done. I don't need to deal with it. Or same thing for the doctors. You came in, you have a major issue. I don't have time. Here's a pill. Zip it. Go back home. You won't tell me your problems next time. And I don't need to hear it. And I don't have time. Let me go and do other things. So that is where we are in a fast medicine mindset, where everything has to be resolved right away, superficially, putting band-aids. And that is why we see, look at even your question, and I'm not criticizing you, but our questions are flawed. If our questions are flawed, then the answers definitely can be right. So is there an emotional aspect? Is there a thinking aspect to healthcare? How would you separate them? Where would you separate them?
I think but thank you for a really wonderful explanatory overview of medicine and healthcare management and so forth. I think, but I still want to return to the question. I think I probably wasn't clear. I want to understand the impacts on the brain and on emotions of long-term substance use. What happens to the brain? I really want people who are listening in to get detail. I want to get the detail, and I think people who are listening in want the detail. What happens to the brain?
One sentence, and then I'll pass it on to Dr. M.
Okay.
It makes us even more insensitive. It dulls the brain. Let me throw it back to you, Dr. M.
Okay. Yeah. So, Dr. M, please carry that on. What happens to the brain? When we're taking these substances that you talked about, does their brain change?
Yes, the brain can change. Depends on what substances you're talking about. There are substances that get into the blood-brain barrier directly. There are very addictive substances. They will come right into the brain. So those drugs that are generally pain relievers, they're analgesics. Analgesics means pain. They're pain relieving. This material can get into the brain area very quickly. It goes through the gut right to the brain. So there's a big connection between the gut and the brain, and there are pathways that will allow for this to happen. It's almost like these little substances, molecules just climb up on wires and get into the wiring from down to up. And it's quite complex for the audience. So we won't discuss all of these.
No, please, well, talk about it in terms of memory, stress.
Yes.
Decision making, calmness, focus. Talk about those sort of things.
Right. So drugs like opioids can really do a number on the brain. I'll just take that category for a moment, and that will lead to alleviation of someone's pain, which can be a pain of 5, 9, 10 in rating. You'd rate it pain 0 out of 10, 10 being the worst. So you can take away pain with an opioid, but you can also lead to a dulling of the senses. So it can make you very sleepy. It can hit the sleep centers. It can hit the centers where you have memory. It can hit your centers that are synapsing together and making for sensibility and cognitive function. So cognition can be affected. Your emotions, they can be dulled. So a lot that can happen to the brain at once, and you can also develop a sense of need for that drug. So we move into the need for dulling the pain and for feeling better. So then you start a cycling of that attachment to that drug, and you increase the pain relief. So you're hitting a certain center that will dull the pain. So that is something you're looking for, and then you take more, and then you take more, and every time you take, the body is happy with that. The brain is happy with it, and you don't feel the pain. So you keep taking this substance. Then you can add another substance, say, to that, something to relax your muscles. So we have an additive effect here. You start slowing things down even further. So that muscle relaxant can also affect the brain, make you slower. You can even become almost like in a drunken state. Your speech can be affected, your brain function affected. You shouldn't be operating anything that is of significance, like a car or a machine, or try to engage in a professional or some kind of meaningful discussion with anybody when you're on these medicines. It really puts you in another state of mind, an altered state. So, I mean, these things can be repeatedly taken because the person is given by Dr. X. You can take this and you can take this too. And if Dr. X doesn't explain and warn you about the use of this drug, this person can just keep taking it. I mean, people go home. We don't go home with them. They can take these drugs, combine them. You can have other drugs also added that can also cause all kinds of issues in the brain, because the brain is a delicate place and it can be affected by these things. So we have all of these aspects of brain function. And I'm just saying in terms of, cognition, memory, emotion right now. I'm not even talking about the rest of the body. So the brain can be affected in so many ways, and with the synergy of other substances, not to mention food, not to mention everything else that goes into the mouth, drinking, and so forth. Yeah. So we've got to be very careful with all the things that go in, and note that, this can affect you, this can affect you, and additive. It could be a disaster. You take alcohol anytime during the day that you're taking opioid or an anxiety medicine or a muscle relaxant, you're setting yourself up for trouble. And so it becomes almost an attachment to these things, because your brain is in like a calm state now. Your body feels no pain, but you be able to function. So if you don't know this, your whole body and brain will start to, you go through these cycles and you will shut down all your normal functionality. You'll become an altered person. And that is such a danger. Yeah. Go from there.
I'm just going to recap on that. Essentially, what you're saying is that the brain can be changed, and you can become a different. And if the brain has changed,
yes,
you are essentially a different person.
Yes,
and
absolutely.
It may be a minor difference or a significant difference, but you don't notice it, and other people don't notice it. But you are changed. You're a different person with these long-term. Wow. Okay, Dr. P, back to you. Talk to me about then. Let's say you have a patient who's been on this on a substance for a long time. Talk to me about withdrawal. And are there difficulties? Let's say they've had the explanation that they need to come off this substance. What are the difficulties associated with withdrawal?
So there are a couple of what we call layers and layers of dependence, right? One is the tolerance. You get desensitized as you keep taking it. The neurons in the brain, the receptors become desensitized. So you have to keep upping it. Now remember, when you take a medicine, it has its own side effects, not just mental or psychological, but endocrine, physiologic, right? Simple example, you take a medicine for pain and it makes you constipated. You take a medicine for cough, your colon doesn't move, colon bacteria are messed up. Now they will create their own toxicity and ammonia and all those things, which affect your brain anyway, your cloud. Drugs can cause dementia. I mean, think about it. Or make you behave like you're demented. And maybe you can say that you're demented to begin with to take such a medicine for a long time. But on a physiologic basis, it can affect your cognition and ability to perceive things. The other big challenge is endocrine problems. So it can affect your hormones. Male hormones go down. It can affect your adrenal glands. It can affect your nerves. Big problem that we see, eventual change in the physiology of the neurons or the body parts themselves. Sleep gets messed up. You start getting more. You can have depression caused by, say, benzodiazepines can induce depression. Higher chance of falls, fractures, and as we have discussed this in the past, we have done research on falls. Balance goes haywire, and as you become more mature in life, physically, you get older, your neurons need to be free of these chemicals. In fact, you have to retrain your body constantly. When you have these chemicals which are very strong, very powerful, then these side effects can be huge. I mean, I can tell you, there was a patient who took methadone and she had small bowel obstruction. Bowels would not move. It was so bad that she had to have a colostomy. Colostomy is an opening from outside into the colon. And yet, she did not want to get off her methadone. This is the level of dependence because it's psychological. I cannot live without my Xanax. I cannot live without my pain medicine. I have to have it. So the physiologic dependences, there are physiologic, what we used to call tolerance, and then the need for the medicine, which can go away, but the psychological need, the behavioral changes that come with it, those are more difficult and are intractable. So a lot of deep engagement is needed with these patients, a lot of education, the fear that they have that they cannot live without the medicine, and they almost become irrational like children. They don't want to be without that medicine. How can I? It's impossible. I cannot be without this medicine. I have been on this medicine for 30 years. My doctor gave me the Xanax to help me go to sleep because I couldn't go to sleep. I still need it. No, science has changed. We know a lot more about these medicines. Let's try to cut down. And we have to do it very gently. You cannot just suddenly stop it because otherwise they'll have a withdrawal, which could be dangerous and breaks the whole approach. Unless they're manipulating, they're overdosing, they're selling drugs, they're doing something that is really harmful, you should not stop the medication suddenly. You have to have a conversation and then have a plan to gently cut down over 4 to 5 months, and then also give them alternative means to empower themselves, whether exercise, good diet, whether exposure to the sun, whether using alternative means to control their pain. Sometimes the pain goes down if you cut down the pain medicine, which is the strange thing that happens because your receptors are desensitized. So as you cut down the medicine, they become sensitive again. There are other alternatives to control pain. Massage, physiotherapy, you can do ultrasound, you can do electrical TENS units, some other magnetic therapy, which is big now, which is used to help depression and which is used to help even dementia, it is being used. So there are a lot of other things. It becomes a vicious cycle, these pain meds, because they feed on themselves. And at some point, we have to gently break it. If you're able to break that vicious cycle of understanding, why do I take it? Because I need it. Why do I need it? Because I take it. Why do I take it? And this just goes on. At some point, if you can free them from their delusion that they need to be on that medicine, then you can start working. Otherwise, it is extremely difficult. And you have to find a hook, something emotional, something that they can lean on to find that strength. Just like a smoker. Smokers cannot stop smoking. You tell them 100 times, they know intellectually they have to stop smoking. They just cannot give up.
It's a very good analogy, because that's a real analogy where most people, even if they're not smokers, can relate to, because most people understand that they know somebody who smokes and that person can't quit. and what you're saying is these long-term substances, they're analogous to smoking.
They are nicotine. No, nicotine is you get and it's not physiologic addiction, physiologic dependence. It's a psychological. That is what a substance use disorder is. It's a psychological need to have something to complete ourselves. You have an innate emptiness which you're trying to complete from outside, and that pain medicine gives you that fulfillment, that completeness, that anxiety medicine, because your whole system is so wired, and you have helped create it in the society and culture and education have created a mess out of our population. And how do we do it? We just bottle it up, stuff it down.
Dr. P, thank you for that wonderful explanation, wide explanation as to problems. Dr. M, after last week's show, I decided to do some rudimentary research on how much is spent on healthcare in various countries. And in the US, it's 18%, 20%, predicted to rise to 23%. You know, in the UK, where I live, we spend 7% of GDP on healthcare. 7%. You've spent 3 times as much as we do. Is this substance, long-term substance use, how significant is that part of the problem of healthcare in the United States?
Well, it's certainly feeding into that whole number. You know, I mean, you have about half of this country, of the United States adults in this country, I want to say adults, have been taking at least one prescription every month.
For how long?
And it's just you know, again, it's a huge business. It's a business. And we have you know, probably a good percentage of that people, probably about 15 or so percent, take multiple prescriptions per month. So we got 50% will take at least one, and you got maybe around not quite 20%, but maybe that figure at this point is taking multiple prescriptions. Prescriptions are big money for big pharma here. And any little disruption in your body, brain is cha-ching, you know, cha-ching. So it's an opportunity for another sale. If you have a sniffle, if your toe hurts, if you're constipated, if you have burning sensations in your bladder, if you have chest pain, if you have indigestion, if your tooth hurts, if you feel depressed, if you feel anxious to enough to kill yourself, you have a drug. There's always a drug, and that is pushed, and it's pushed on media, by media. Everybody turn on a television, and you know, the first thing you're going to see is advertisement for drug X, or you know, multiple drugs. You'll see, if you're watching a program, you'll see different drugs being promoted. And again, that's the whole direct to consumer marketing ploy that they're using in this country and in New Zealand. These are the only 2 countries where that is allowed. Why is it allowed? It's not right. We need to change that. We absolutely need to change that. As I've said before, it should never be. But you know, there are other ways. You know, we can make this economy roll, and it shouldn't be that we drug our people. And in my corner, I'm trying to take people off of these substances. I have to.
Hey, I've got a question about that before you go there. So let me ask this question. It's a question to both of you as we're going to wrap up in the next 5-10 minutes. So what are you doing in your practice that is successful in weaning people off these substances, and how successful are you?
Well, you know, the first thing you're going to see is advertisement for drug X or, you know, multiple drugs. You'll see, if you're watching a program, you'll see different drugs being promoted. And again, that's the whole direct to consumer marketing ploy that they're using in this country and in New Zealand. These are the only 2 countries where that is allowed.
How successful are you?
You're asking me?
Yeah.
Okay.
So we'll start with you, and then we'll do the same to Dr. P, and we'll compare notes.
Okay. What do I do? Generally, I explain what we're about to do. And the reason is that I'm here to help you restore your health, restore your brain, body, the whole thing. And so I do I take them by the hand, and I have to explain step by step what we would do. Say it's a pain medication. We very slowly take that off as I put some other means or mechanism. Now, I could be using meditation, or I could be using a form of exercise, or some other emotional freedom technique. There's something that I can use to help them reduce their pain while they're reducing the drug. And it's a slow process for most people. Some people it's not so slow because they haven't been on the medicine for very long. The ones who are on for months or years, we have to be very, very slow. And it could be an anxiolytic drug, for instance, a Xanax type, or one of the Valium type drugs. That's the mother drug, Valium, and then you have all these subtypes. That kind of medicine we have to really be super slow with because of the withdrawals and the dependency, as we talked about. So it has to be extremely slow, and even down to like taking a small bite of a tablet. As we add other things in, well, it could be even I change the diet. A lot of people don't know that their diet is causing their anxiety and their bowel problems and their brain problems otherwise. So gluten, for instance, in many cases, gluten, the substance in wheat, barley, rye, this can cause a lot of mental issues and gastrointestinal issues, and there is connection. And if I could take them off of gluten, that can be solving a lot of this problem and get them off of drug even faster, because they're on the drug probably because they're eating gluten. I can't tell you how many people are being drugged or given drugs when they need to come off of a food substance that's creating the problem. Gluten can cause everything from major GI tract problems, pain disorders, joint problems, muscle problems, anxiety, depression, schizophrenia. I mean, they've tied it in with just about everything. And it's amazing what happens when you start taking people off of just gluten. That's one thing, but there's a lot of other stuff in the food industry that we would take and need hours to talk about. But
so these strategies that you're using, how successful are you? Well,
they are successful.
Don't be modest, but how successful are you exactly?
I would say, if I had, 100 people, I would say about anywhere between 85 and 100 and 90% of them are going to be taken off. I can take them off of these drugs, but they have to follow. That's one rule you must be solid with. You got to be in solidarity with someone like myself. You have to be on it with me. We have to work together. And those who work together, we have absolute success. If I could work with them, but it requires time and their investment in it. They have to be invested. They have to say, I'm going to do this. And I want it because I don't want to take this. Even a drug for thyroid, a thyroid replacement, unless they have no thyroid, we can take them off of thyroid medicines when they were diagnosed as an underactive thyroid. We can restart that thyroid. If somebody has a heartburn problem, we can take them off of heartburn medicine, but that takes a long time because these cunning, clever manufacturers of this drug for heartburn, they made sure that it would be very difficult to take them off because it's so powerful. And people come off, they want to go right back on because they feel, terrible off of it.
Right.
So that is addictive, that particular drug. And we can help them come off of that drug very successfully. It takes a long time, but I have the patience with them. That's what I have to do.
Dr. M, congratulations on all that you're doing, but also, on behalf of all these people, thank you. You must have saved countless lives and made countless lives better. So, on behalf of them, thank you for what you're doing and your focus and your real drive to make people's lives better. Thank you so much. That's brilliant. Dr. P, so talk us through, same question. What do you do to sort of take people off long-term use of these substances, and talk us through how successful that is as well, please.
I have the same success rate as Dr. Scanziano, actually better than her, because what I do is all my patients I send to her to fix them, so that I get her 75-80%.
You're taking credit for passing them to Dr.
All those are my patients, so that's done. And then a couple of them I fix myself, so my statistics is better. So I just wanted to get that out.
Yeah.
But also remember, the big challenge. And see, Maria created a space for herself, which is actually very admirable, which is a system of healthcare that is not entirely dependent on even the government, the insurance companies. People come to her directly because they want to come to see her. They have a challenge that they want to fix. My system is really the traditional space of insurances, dealing with insurances, the diktats of the government. You have to have, if your patient is not on a statin, then your quality scores are low. We're going to ding you. If every patient has not had a flu shot, they will ding you. If everyone doesn't have a mammogram, a colonoscopy, patient's hemoglobin A1C on December 31st was above 9 all year. It was beautiful. But on that last day, because they had a great Christmas meal and A1C went up, now you're a bad doctor. Blood pressure went up because yesterday they had a pizza with beer and now the blood pressure went up, but all year you had it controlled. Now you're a bad doctor because it was the last day.
Yeah.
We have created demands on ourselves which are artificial.
Yeah.
And the problem is not only are the patients addicted to drugs, but doctors are addicted to drugs. Today, I had a patient who has been on a medicine that he does not need to be on the medicine anymore. 1 year, you have a stent, the medicine needs to go off. 1 year, that's their standard. So I say, you can get off. No, my cardiologist doesn't want to get me off. I text the cardiologist. It is not needed, right? It's not needed. Shall we stop it? Let's wait. Let me see him and then I will decide. That buys another 3 months. Actually, we are not following even the standard of care in modern medicine. Patient is on Ozempic. Hemoglobin A1C is 4.7. That's dangerous. But the diabetologist, the endocrinologist, does not want to stop the Ozempic. Patient's weight has gone down. Patient's A1C, everything has gone down. Stop it. No. So, not only are patients addicted to drugs, our doctors are addicted to drugs, our insurance companies are addicted to drugs, our pharmaceutical companies are addicted to drugs, and our government is addicted to drugs. These are clear prescriptions. You will give this medicine to this patient. So when we create such artificial demands on our ability to heal people, we have tried to standardize medicine so much that we have given up on individualization, personalization of medicine. Each human being is different. Each person has his or her own physiology, chemistry, anatomy. That is well known for thousands of years. One medicine is an elixir to one patient, it is poison to the other. Why? Because the body phenotype is different, the physiology is different, as we see in Ayurveda. And yet, here, We have standardized it to a point where we are no longer dealing with human beings, one-on-one individuals. We are dealing with cattle. Everybody has to have it. If you don't have it, you're the problem. If you don't give it, you're the problem. There's no space for individuality. So my discussions with my patients, one is, of course, because of my personality, they're all amused. So we have a good time. But also to educate them about what the problem is. A lot of them see through it. Most of them are mature enough to see through it. Then getting away from that vicious cycle, that is a challenge because these bodies have been beaten up. They're on these meds for such a long time. It requires enormous patience, connection, engagement, and immense dedication from the patient and the whole system. So that is the challenge we live with. Having said that, my scores are nowhere as good as Dr. Scanziano unless I refer patients to her. But it is a challenge, and the more traditional the medicine gets, the more difficult it is.
Well, Dr. P, thank you as well for the work you do with your people and your real care and dedication to fixing people. I've known you a long time now, and I really see that care and dedication in everything you say and everything you do. It's right from the heart. I thank both of you as we now break. We now break until the new year. This is the last episode of 2025. I wish both of you a happy Christmas and a great New Year, as we do to our audience as well. Any final words from the two of you, Dr. M? Anything from you as we call time on 2025?
Celebrate every breath. Every breath counts. Every bite counts. Celebrate these which have been, life-giving, and don't be foolish with what you breathe in, what you eat, and the company you keep. Make sure that it's good. It's all positive energy. Don't ruin yourself in these holidays, and have a wonderful New Year.
Fantastic. Thank you so much. And Dr. P, the final word obviously has to go to you, because there's got to be a clever remark and a funny remark from you as we close, please.
No, it would be funny if it were not so painful. But let me say this. Empower yourself. I will tell our patients, empower yourself. Every medicine you're being given, don't take it for granted. Keep your notes, write down your questions, work with your doctor, and help them help you. Do not think that the doctor remembers you after 3 months, after seeing another 1,000 patients, that they know exactly. So keep notes, help them be precise, give the coherent story and have your own plan so that it helps the physician. Empower yourself, learn about your condition, and allow other views, other perspectives on health than just those of modern medicine. Modern medicine is not that modern, by the way. It has a whole long tradition. And if we look at the traditions, there are a lot of good things our parents, our grandparents, our forefathers did to heal that are still relevant, and I still use them, and sometimes they're even better than our pills that we drop in. The ancient wisdom, the Magi, what did they take when Christ was born? They took gold, of course, we'll take it, but then myrrh and frankincense. Myrrh and frankincense. Those are still available. You can still use these to heal yourself. And so could you use hundreds of natural things that are as healing, as good as any other drug you need to pop in. You don't need to take that morphine. Use something that is natural. Use the turmeric, use the frankincense, use the menthol, use other modalities, ultrasound, some physical therapy, physiotherapy, something that may be as effective or even more effective. You don't need surgery for every condition. This dependence on others is absurd. It is harmful to you. And one word, do you know what word you need to say to your doctor to improve your health?
No.
Do you know that? She doesn't know that. Do you know that?
Please. No, please tell me. Please tell us. No. That's what Dr. M said too. No.
No, she said it because she didn't know it.
Dr. P, that's quite enough. So now, because of that, I'm going to give Dr. M the very last word for 2025.
Frankincense, aka Boswellia, for the audience.
Ancient Indian treatment, but also ancient treatment for many cultures.
I have it, and we use it every day. Right. It's wonderful. Please use it. Know it's there. And yes, it is an ancient.
And it smells nice too. Besides my, stinking medicine.
Yes.
Thank you both. Thank you both for a great start over the last few months to our Happy Health Hour podcasts. We will return in 2026. Thank you, Dr. P, Dr. M. Bye-bye.
All right. Bye. Have a great one.
Bye-bye.